So BPH is benign prostatic hyperplasia. It's the benign, the enlargement of the prostate, which happens in men.
Okay.
So, this is probably less on the minds of an 18-year-old and more in the minds of guys 40 and older.
Okay.
But what happens with time is the prostate grows slowly in every man.
Okay.
Like your hair grows silver.
So this is not like this. This
is not
standard.
cancer.
This is standard. Your prostate
This is not
enlarges.
cancer.
Okay.
The prostate grows with men.
Okay.
Every man. Some it grows faster, some it grows slower. And if you just look at the anatomy of the prostate and where it is, so the urine starts in the bladder and it flows right in the middle of the prostate. Okay, so as the prostate grows, it can block the urinary canal before it goes into the penis. Okay, and this can cause problems.
Okay.
And this can cause urinary problems. So what happens? The prostate grows and as I said, blocks the tube and can cause a variety of symptoms such as having to pee often. It's counterintuitive. Why, if you're blocked, you pee more often? Well, it's the bladder becoming more active as it's getting angry because it's being blocked. So you get a blockage and you've got the bladder pumping and people are, men are running to the bathroom, particularly at nighttime. They'll wake up 3 or 4 times at nighttime as opposed to none or once, which is the average. They may have difficulty to pee, have to push it out. The reason why it should be checked either by a urologist or by their family doctor is, one, if it's bothering you.
Okay.
If you're waking up 4 times a night and you can't function during the day, or if you're running to the bathroom, you can't sit through a movie, if you have any other symptoms that go with it which are concerning, burning, pain, blood in the urine, really difficulty to get it out, you're near blocking completely. These are some of the other or sort of more important.
All that is that your prostate's enlarged.
Typically,
okay.
Which will take us to the next topic of what causes these symptoms. Yeah. And enlarged prostate is the most common cause of these symptoms in men, but there are many causes of these symptoms, and that's why your doctor has to look into it and see what's actually causing before they go and treat it. When you come to your doctor, they'll probably ask you for some simple urine test, blood test for prostate cancer. They should feel your prostate to see if they can feel for prostate cancer. Simple rectal examination.
It's as simple as that. Like they could feel right away just through the rectal exam?
It's not perfect as an exam, and you can miss a lot, but if there's anything major happening,
they'll feel it.
They'll feel it.
Okay.
And there's other tests that we do depending on what the symptoms are and if there's any other. Like I said, if someone has these symptoms with blood in their urine, well, they're going to ask for a CAT scan. They're going to do a little cystoscopy, a little camera into the penis to see what's going on. They may do this test where they can actually, sounds funny, but we get you to pee into a toilet, which is attached onto a computer, and it measures the flow. And so there's all sorts of things that we can do. Very few of them are necessary in your average patient with an enlarged prostate and some symptoms. So it's you have to look at the degree of symptoms, but also the degree of botherness, how much it bothers them.
Good point.
So there's very few times where we actually have to treat. The reasons why we have to treat if it's starting to affect your quality of life, but also your life. So if you're blocked and you're not emptying your bladder, that can cause damage to the kidneys.
Oh, that's true.
So that's a complication of an enlarged prostate. Or recurrent bladder infections. You're not emptying your bladder, urine just sits there, and you're more prone to get an infection. So these are some of the reasons why we have to treat. Treatments are typically effective, medical treatments. We have a group of medications which relax the prostate.
Okay.
And open up the passageway while you pee, and can Flomax, Zatrol, Rapaflow. So there's many medications in that group.